Shoulder injuries are one of the most common types of injuries that lead people to seeking out orthopedic care. Now, the shoulder is a highly mobile joint, allowing us to do a variety of different things, getting into different positions through a large range of motion. Because of this inherent mobility that we have, unfortunately, it's not the most stable joint. So it lends itself to being more easily injured than another type of joint similar in structure, such as the hip. The hip and shoulder are both ball and socket joints. However, the shoulder joint is a much more shallow socket. So when we look at the anatomy of the shoulder, we need to get familiar with all the different parts and pieces, and we'll start with the bones. And when we talk about the shoulder joint, we often refer to the glenohumeral joint. The glenoid is the socket part of the joint, and that is part of the scapula, or the shoulder blade. The humerus is the arm bone, and that is what makes up the ball of the ball and socket. Now, these two bones fit together and they articulate very well, but they don't have a lot of depth to them, making it a more unstable joint. So we have another structure, and it's a piece of cartilage called the labrum. This wraps around the rim of the glenoid, and it provides more depth and more stability to the joint. Outside of the bones and the cartilage, we also have a variety of ligaments that surround the joint, and these provide more structure. Ligaments connect bone to bone, so they are designed with a lot of stability in mind. Lastly, we have a variety of muscles that surround the shoulder joint itself. 4 different muscles form the rotator cuff, and the rotator cuff muscles share a common tendon that encapsulates the glenohumeral joint. These 4 muscles are the supraspinatus, the infraspinatus, the teres minor, and subscapularis. They play a large role in obviously rotating the shoulder through internal and external rotation, but they also provide a large compressive force, almost acting like a suction cup for the glenohumeral joint, and this helps keep the humerus in the socket, so it helps reduce the likelihood of a dislocation occurring. In addition to the rotator cuff, other muscles that you will find in this general area are the deltoid, the pectoralis major, the trapezius, notably the upper trapezius, our latissimus dorsi, or our lats, our rhomboids, and then there are a variety of other smaller muscles that attach to the scapula and help keep our scapula close to our rib cage. This articulation between the scapula and the rib cage is called the scapulothoracic joint. This joint is what allows the shoulder blade to move up and down. The shoulder blade can elevate, it can depress, it can retract and protract, and it can also have an upward or a downward rotation to it. When we think about shoulder motion, a lot of the motion does come from the glenohumeral joint or the ball and socket, but it also comes from the shoulder blade moving fluidly and smoothly on the rib cage. In addition to the glenohumeral and scapulothoracic joint, we also have our sternoclavicular and acromioclavicular joints, and this is where our clavicle or our collarbone comes in contact with our sternum and with the top part of our shoulder blade or our scapula. So when we look at the shoulder, think of it more as a shoulder complex with a variety of joints, and don't get too tunnel vision just on the glenohumeral joint. In our previous videos covering different shoulder-related injuries, we've talked about rotator cuff injuries and we've talked about labrum tear injuries. Another common group of injuries are muscle strains or muscle tears. And there's a variety of different muscles that can be involved with shoulder-related activities, but the pec muscle is one of the more commonly ones that you'll hear referenced when we talk about strains and also tears of shoulder muscle. With the pec muscle, we have the pectoralis major and the pectoralis minor. Pectoralis major is the one that we're commonly referring to, or the one that is more often injured. The pec major muscle is primarily a flexor, so it brings the arms up or it pushes out. A horizontal adductor, meaning that it is bringing the arms closer together in this direction, or an adductor in this direction. and it has an internal rotation component to it, meaning it brings the hand closer to the body. From a more functional standpoint, the pec is mostly involved in pressing. So think about a bench press or a push-up. And those are common weight room and strength training related injuries of how you'll see a pec tear or a pec strain occur. From an athletic component, it can happen with any pushing activity, but also if we push the arms in the opposite direction, so going away from the body and behind the body is going to stretch that muscle out very rapidly and very forcefully, and you can sustain a pec strain or a pec tear that way. So oftentimes, if you find somebody attempting to make a tackle or attempting to make a block, say in a football game or a rugby game, their arm gets caught up and it gets pulled behind them. They may have a variety of shoulder injuries, but a pec strain or tear being one of them. If somebody is trying to do a little bit too much in the weight room from a bench pressing standpoint, you often see this when people try to do a 1 rep max, and they try to do a maximal amount of weight for 1 repetition, and they're either not properly warmed up for it, or they're just doing a weight that's inappropriate for them, and that can cause a pec strain or a pec tear. If we sustain a pec injury, and whether it's just a mild strain or a full tear, we're gonna have to go through some sort of rehab to get us back to full function. With this, we are going to need to do a degree of symptom management. So depending on how much swelling, how much bruising, how much pain they have, they may be taking prescription level or over-the-counter medications for pain and for inflammation. You may be giving them guidance on icing, heating, or some degree of compression and gentle movement to get fluids moving and to help get them in a more manageable standpoint from a symptom profile. But the big thing that we're really going to focus on is restoration of range of motion and full mobility, and then getting them back to full strength as well. How quickly we progress through these activities is going to depend on the level of injury they had, if they're treating it conservatively, or if they're going through any sort of surgical intervention. If they do go through surgical intervention, the type of surgery performed and the severity and complexity of that surgery will also influence how quickly you are able to move through the various stages of rehab post-operatively. Today we're going to speak in generalities, and we're going to cover mobility and strength progressions, and with the mobility, we're going to cover different activities that look like maybe a more basic stretch in the beginning, but how can we turn that into a more total body movement progression as we get through later phases of rehab. From a strengthening standpoint, we're going to take something as basic as a push-up, and we're going to increase the demands in regards to the amount of resistance that we're doing, the position that we're in, and the amount of force and speed that we are going through. This is often referred to as plyometrics or power training, and the big key factor here is they're not only being asked to produce a large amount of force, but the rate of force development is key. So we're asking them to tap into that high level of force instead of in a slow and controlled manner, in a much more accelerated manner. All of these injuries will look similar to potential mechanisms of injury of when they actually had the injury occur. So keep that in mind with regards to progression, with how quickly you ask them to do things, but also keep in mind that the patient and the athlete themselves may be a little bit fearful or maybe a little bit avoidant in getting into some of these positions if it brings up old memories of how they got here in the first place. So when we're talking about restoring mobility after a pec injury, we can often think about a traditional pec stretch. And a traditional stretch that we often encounter is one where we are in a door frame and we have an individual with their arm up and out to the side, almost in this 90-90 position. It's traditionally a very static stretch that you're holding for about 20 to 30 seconds. But when we have a pec injury, it may be difficult to tolerate that position or even get into that position. So a more regressed version of that we can use in the beginning stages is by bringing the hand down and simply having them step in and out of the door frame or out of the squat rack. So with this, I like to have the hands start about waist height. They're going to take their opposite foot and they are going to step forward. As they step forward, they're going to lunge forward, think about bringing their chest towards the wall, and then come back. A larger step will come in a more exaggerated stretch, or a shorter step can be taken to gradually introduce it. In order to stretch the pec, we need to flex the arm or bring it progressively more overhead. We need to horizontally abduct the arm or bring it more behind us, and we need to externally rotate the shoulder or bring the hand up into this position. So keeping that in mind, there's 3 different motions that'll stretch the pec. We can simplify the stretch by just zeroing in on maybe 1 or 2 of those motions. So with this one, we have the hand a little bit lower and it's not as externally rotated, so we're focusing more on that horizontal abduction or getting the arm behind our body. You could make this more challenging not only by increasing the step length, but you can bring the hand higher up. So as they get a little bit more tolerant, you can have them progress into higher levels of being overhead. As they get better at that, if desired, you could coach them up and train them in that more traditional pec stretch, if that's something you're looking for. Keep in mind there's a time and place for doing a more static or a more active stretch, so make sure you're picking and choosing accordingly. So we covered one way to do a pec stretch with a more active approach in a door frame or a squat rack. Another progression that we can go into is from a side lying position. And you'll often hear this referenced as a side lying rotation. Some people like to call it an open book stretch. But a common theme with this is the hand is going to be away from our body and we're going to be getting into that horizontally abducted position, but there's a degree of trunk and body rotation that's happening as well. So we're starting to get a few more body parts and making this more of a total body activity. So with this, we'll have the individual on their side, we'll have their legs bent and their legs together, and we'll start with their hands together as well. From here, they're going to keep their bottom arm in contact with the ground, but bring the top arm up and over, and they're going to try to get their arms and shoulders flat against the ground and then come back to the starting position. With this, they're going to have their eyes follow their hand, so wherever their hand goes, their eyes go with it. With this activity, an added benefit is we're getting trunk rotation and we're retraining their body how to dissociate their hips or their lower body from their upper body. And the ability to rotate and have opposition of where the hips and pelvis are going and the trunk and shoulders is going to be key with any sort of rotational sport you're trying to get back to, such as throwing or hitting, whether that be lacrosse, baseball, ice hockey, softball, or any of your other throwing sports. So another way that you can work on rotation to get a stretch of the pec is by keeping the upper body stationary and using the legs to drive the motion and to accomplish the stretch. So with this, we're going to use a dumbbell and we're going to have the hand that we want to get stretched out positioned under the dumbbell. And the dumbbell is going to keep us flat on the ground as we rotate our legs up and over. With this activity, the positioning of the hand and whether you have it to the side or more overhead will give you a more or less intense stretch, with more intense being above our head. With this, as you rotate the leg over, the higher you lift that foot, the more of a stretch you'll get as well. So it'll look like this. We're going to be on our back. We'll have our hand under the dumbbell, and I've got it directly out to the side of my shoulder. You could also position it higher up here. If the right hand is under the dumbbell, the right leg will be moving, and we're going to bring that leg up, and then we're going to bring it over. Now the dumbbell is keeping my hand from coming with it. So we have the hand under the dumbbell, We come up and over, and then come back. This is best performed for about 5 to 10 repetitions on one side, and then switch over to the other side. With this, you can progress by holding for extended periods of time or getting that arm higher overhead. So moving into strength-related progressions following a pec injury, one of the easiest ways to train this is by utilizing the pushing or the pressing motion. So we're going to start with a basic version of a push-up. And we're going to make this easier than a traditional push-up by changing the angle that their body is in. So instead of being on the ground, parallel to the ground, we're going to put the hands on an elevated surface. At home, this could be a countertop or something solid and stable like a kitchen table. In the gym, what works really well are squat racks that are adjustable. So we could position this barbell higher or lower, lower being more demanding on the pec. With this, we'll keep a more traditional hand positioning of being roughly shoulder width. A wider hand position will put a little bit more strain on that pec, so be mindful of what you're coaching and cueing or attempting to do with this. For this activity, just like a regular push-up, we're going to have them go through the lowering and raising motion, and ideally we have them at a position that they can tolerate but feels comfortably challenging. With regards to elbow position, we don't want elbows to be tucked all the way in. We also don't want them to be all the way out. So somewhere in between is going to be what's most appropriate and most comfortable for that individual. Now, we can play around with the tempo that we were asking them to do, and we can have them go very slow. So about 3 to 5 seconds on the way in, and then regular on the way out. That slow lowering is going to take momentum out of the exercise and place a little bit more demand on that muscle. This is a very good way to introduce higher level strength demands without asking the individual to move any more weight or increasing the resistance. With this, like any strength training principle, you can have them do 2 to 3 sets somewhere in the 8 to 12 rep range. If they are able to do far more than that, then we need to make it a little bit more challenging by slowing the tempo or lowering the bar down. If they are struggling to do that many reps and you cannot modify how high you can have them go, you can have them just go at a slower pace for a slower number of repetitions, or find other ways to provide them with assistance. And if they're still struggling with that, we need to just scrap the exercise and find something easier for them to do. If this is too easy for them and they've been able to progress all the way down to a push-up, now we can have a little bit more fun with teaching them how to do things with a little bit higher rates of force development and getting into what we'll call more of our plyometric and more of our power-oriented movements. So let's head over to the turf and see what that looks like. So we just went through ways to make a traditional push-up a little bit easier. Now we're assuming that the individual can do push-ups with ease, and they have already done a little bit of strength training with various pressing activities. And the focus now is moving not only higher levels of force, but at a higher rate of speed as well. So with this, we're going to introduce a little bit of plyometric training, but we're going to break it down into the concept of force production or propulsion. So with this, we are only focusing on the up motion of this exercise and how quickly they can get up. So with this, we are going to start in the down position of a push-up, and we're going to have the individual on their knees. Their goal is to press up as quickly as they can into the up position. Now with this, they may actually feel their hands come off the ground a little bit, and that is okay. The reason that we're going to be starting in the down position is we're trying to eliminate momentum. We don't want them to be able to utilize any momentum going in to help them come out of the motion. So for this, you will ask them to start in the down position, hands at the same position that they would for a traditional push-up, and then you're simply going to have them come up as quick as they can. Now, they may come off the ground, and that's fine. If they don't come off the ground and they just move quickly, that is fine as well. Coach them to move as quickly, as forcefully as possible, and what you'll more often than not find is that they actually come off the ground a little bit. If they are able to consistently come off the ground, then you can begin adding objects. So you could put a small plate or a small box on each side of them so that they would have to then elevate up to that box. With this, it is a more forceful and a more powerful activity. So make sure they can do the more remedial version successfully and competently without compensation. And when you're doing this, you won't do as many reps. You may only be doing somewhere in that 3 to 6 rep range, and you're going to be giving them a little bit longer rest break in between sets to make sure that they're fresh and can move at their full speed. We're going to talk about the opposite end of plyometric training. And this is no longer the ascent, but the descent or the loading phase of this pressing exercise. So again, we're only going to be moving in one direction with this, and it's going to be going into the lowering phase, but we're going to start from an upright position. So we're going to have a little bit more momentum and a little bit more force that we're going to have to control with this. For this, the individual will start on their knees, on the ground. You could also have them standing and doing this to an elevated object. I like to utilize the ground though. And with this, we're going to have the individual try to be as upright as possible, meaning we are not bending at the waist. Arms are going to be out in front. They're going to fall forward, and as soon as their hands hit the ground, they're going to slowly lower themselves down to the ground. So it'll look like this. Then they will simply walk back up. A lot of pec injuries we talked about occurring when they get hit with a force and the arms come quickly and forcefully back behind them. This is helping them prepare and train for any impact that they may encounter where that pec is going to be quickly stretched out and they need to counteract that resistance. With these falls or these controlled falls, treat it just like your explosive presses from the ground, where you're doing less reps with a longer rest break to make sure that they are properly rested and ready in between sets. Hopefully this video shed a little bit of light in regards to one of the common orthopedic injuries related to the shoulder, which is a pec strain or tear. If you find yourself in this condition where you need to seek out guidance, make sure that you find a physical therapist or an orthopedic who can provide you with information regarding the severity of your injury and the best plan of care moving forward and what those options look like. If you found this video helpful, please like, share, and subscribe, and stay tuned for our other series where we start to highlight hip-related injuries.